chiropractic care and baseball, they need to go hand in hand.
So usually we have to wait until we get back to the States, and that's when I'll go see Fred Hayes.
As a 56-year-old man, I'm not having any problems because I think of the way I rehab.
He kept me healthy enough to pitch for 4 years there, throw a lot of innings, get me drafted.
I was fortunate enough to be able to come back fully 100% with full strength and basically better than I was before my surgery.
Every college, should have a sports chiropractor that they refer to or should be part of the team. By adding chiropractic to the whole sports medicine program, we're able to affect the joint a little better, restore the biomechanics and the function of the joint before we rehab it.
You have to institute all three portions of our rehab, not only the chiropractic adjustment to restore function, dealing with the scar tissue, and then lastly the rehabilitation and strengthening.
The threefold is you got to take care of the adhesions first. Through ART, we're able to address a lot of the scar tissue in the backs and necks. Then the chiropractic adjustment, because you have to restore the motion, take the pressure off the nerves in the spine, which allows healing and allows the body to function at the highest level. You go into a rehabilitation phase. So that rehabilitation phase is very important to strengthen everything up. That's where it can really help, not only the athlete, but the regular person that hurts their back from picking up their child or lifting something at work, or even those auto accidents that have the whiplash or the lumbar sprain.
They know exactly what I'm coming in to treat, and they know what I need to do and what I don't need to do.
When Dr. Hayes would come once a month, there was a line out the door, and they were all baseball players. They loved what he did, they loved the results, they felt better about themselves, and they were better, stronger pitchers, stronger position players as a result.
He does a great job of joint manipulation where if there's a problem, he'll take care of it right away.
We have immediate results with a person that will have, say, front of their shoulders bothering them. They will come in and just a simple one-time procedure going through with the actual ART, their shoulder will feel almost 100% better.
We do try to emphasize strengthening and stretching rehabilitation, and we try to encourage the kids to stay fit their entire year.
We make sure they're prepared to go to college and play at the next level without having overstressed their bodies. And all of that is part of taking care of problems before they happen.
Like from hitting can be very strenuous on the lower extremity. So I go to get flexibility work out of him and to get realigned so everything's in the proper order.
I work a lot with my football coaches. We've instituted a whole weightlifting program year-round, and we've seen that my injury rate has decreased significantly.
You have to be in that positive mindset and to have somebody pushing you to be able to get better and show that improvement and stay positive. And sure enough, a week, 2 weeks, a month later, depending on how severe it is, they start seeing improvement.
You walk into Dr. Hayes' office and it's filled with athletes, and they're all doing rehab, they're all doing stretch techniques.
We work with several orthopedic surgeons who refer to us for post-surgical rehab. We do use the modalities, but we also start exercise and strengthening a lot sooner, and that seems to get people back a lot quicker.
An adhesion is basically scar tissue that builds up in a chronically overused muscle or tendon or ligament. Through ART, which is called active release technique, we reduce the adhesions that have formed from just rest or lack of use. A lot of people believe that I just want to rest my shoulder and then all my injuries will go away. Well, that's not really true.
And you do the ART on me and do some range of motion techniques just to kind of get a lot of the bad stuff out of my arm and to make it feel real live and healthy again.
Because anytime you go in and cut a muscle, anytime you go through and cut fascia, if you don't strengthen that back up and you just allow the patient to just heal, they're going to have problems later in life.
The kids that they've dealt with come back quicker. There's no doubt about it, and she's very upfront with them. I think she's very aggressive, but I don't think she minces any words. She just, you can play. If we do this, you'll get to this point, you'll be involved again. If you don't do this, you won't.
So rather than waiting and losing physical strength, they're able to get back onto the court, having lost very little of their competitive edge and their confidence.
When I had knee surgery, a major knee surgery last September, and it's been a little over a year, and I've gone to him to get some deep tissue work to help get that flexion back in that knee.
Breaking up scar tissue is an aggressive technique that that Fred and Gina and the rest of the staff use.
We'll be able to take that athlete, if they're not gone past that point where surgery is needed to repair that, we get them up to that point and then get them better. And I think that's what appeals to a lot of coaches.
You look at the torque of a position player's swing, you look at the torque of a pitcher and all the different mechanics that are going on in the back, in the legs, in the upper body, in the arm. Kind of amazed that there's not more chiropractors working with teams.
Kept me on the field in college and kept my arm healthy and a lot of preventive treatment.
But I can't maybe get the proper treatment until we come back to the States. So that's when I come knocking.
The treatment that the regular doctor put me through, it wasn't doing anything for me.
I did the rehab there for about 6 weeks, and my impression was they were as up to date as anybody I'd seen.
Fred is the best.
He's been not only just a good doctor for me, but he's a good friend for me as well.
Just about 100% of the people here are amazed with how good they feel, you know, immediately after that first therapy that they have.
It's the best blend of chiropractic and athletic training and physical therapy around, and that's kind of why I do what I do.